Hello, I'm Robert, and this is a talk about the long-term situation, about what's happening with the Omicron wave. And this subtitle shows very well, is a very good summary of what's happening. And in my previous video, I went through very quickly, I'll just go very quickly to introduction what's happening. So as you can see, it peaked in South Africa early on, and they are actually getting fewer deaths. This is the what's happening than with previous waves. This was happening in London, where it's already peaked in cases. The hospitalizations are expected to peak soon. The intensive care units far less use than in previous waves. Indeed, they are moving people from intensive care to the general wards to help out there. The cases have peaked in London already. The very few vented additions. It just continuing as for Delta, and there's very few by way of deaths. So it's a much less serious, about 15% of the deaths they were saying than for previous waves. This shows all the boroughs of London, and they are all peaking at different times, but most of them have peaked. And this is very accurate information using the Public Health England. They do random tests of people in the population. This unlike the previous ones, it's not new cases, but it's people who actually have COVID. And the fewer people now, and it peaked around Christmas Eve, the number of people who actually had COVID in London, and it's falling. It peaked at just below 10%, it's quite a very high number. And this is the cases, and you see cases are falling in nearly all age groups except for the 80 plus, and with 80 plus then it's we don't yet know what happens with them because we don't have very much experience, but the United Kingdom, they are boosted and they're very well vaccinated. This is an estimate, and this seems the best estimate of what will happen. You can see expect to fall back down after a very high peak of cases. Then and then it's going to fall right back down as in early February to March, and this is the most likely possibility. That's about. So then, what else we have? It's happening in many other countries, and so this shows how there's a great deal of difference into how many are unvaccinated. In many countries where they aren't high levels of vaccination, in those countries there often is a high level of infection. But there's some countries like the United States and Austria where there are many people who are neither vaccinated nor are they have they been previously infected. And so we have yet to see what happens in those countries, and there is a higher risk of people dying because an awful lot of these low levels of deaths are because of the lack of vaccination and previous infection. So that's so now if you go and look at this, then this paper explains that many countries are banking on early indications that the vaccines still protect against severe disease, that Omicron may be a gentler variant. And it's a risky bet, but they go on to explain that initial data suggests that they may actually have won their bet to a certain extent. But they do come with some major caveats. So initial data suggests it causes less severe disease. They come with major caveats. And even less severe disease can strain the hospitals. So, and they say they're biting their nails, hoping the cases will soon peak and begin to fall. And they already have in London and in South Africa. So I'll talk about that in a separate video, how it differs from previous variants. There is things about the science that suggest that it is spread more easily, but it could easily be less severe. And so this is about what I was just explaining the data, that cases already started to decline, suggests it put a third of as many people in hospital and many fewer deaths. But that's probably because of the previous infections and the country's relatively low young population. Now, the initial data from England and Denmark suggests the Omicron cases are less severe, but they have high vaccination rates. And it's also spreading amongst young adults. And then the question is it capable of causing less severe disease in older age groups? And the biggest risk here really is in London, because as I said, they've got far fewer people vaccinated than in United Kingdom, and they also have managed to keep COVID out quite well with their lockdowns and other restrictions. So it's the unvaccinated people who have not yet been hit by COVID at all that are the big unknown. And then the other signs are that it can trigger dehydration from fever, vomiting and diarrhea. And although they don't need intensive care, they do overwhelm the hospitals. And Dr. Maria van Kerkhove, and she recommended this article, technical lead of COVID for the World Health Organization. And she says that she hears story after story of hospitals that are full and healthcares that themselves are infected. That's happening in England. She's saying she's hearing it around the world, and they can't do their job because they're isolating because they've got COVID. So this is the main problem. And so how severe they are in people who are epidemiologically naive, then they're a minority, but they could, and we're getting deaths in Ghana, Ivory Coast and Madagascar where vaccination rates are low, and they're increasing sharply, which suggests that there may well be quite a few deaths in Omicron people, in unvaccinated people. So especially need to be careful about those. And but it does seem to be less severe than the previous variants. And the Omicron is maybe milder than Alpha or Delta, but it doesn't seem likely, they're saying it here, that it evolved to be less mild. Or at least it seems that a likely hypothesis is that it evolved from a milder version. So if you could get ancestral COVID and bring it to the present, it wouldn't spread because it just couldn't compete with the new variants. It would just dwindle out. It wouldn't be a variant of concern. But if you could bring it into the present and give it extra transmissibility like Omicron, it would probably look like Omicron. Because Alpha was more severe than ancestral and Delta was more severe than Alpha. And so with the new variants, we've gradually gotten used to a more severe variant, and then we haven't had such increasing deaths because we've also got improvements in the pharmaceuticals, which have been made it better and also more used to treating people with oxygen and knowing exactly how and when and where to use the oxygen. And for all those reasons, then Delta is not as bad as it could have been if we were hit by it in January 2020, because we know we are much more accustomed to treating it. And so with Omicron, it seems less severe because it may well be the same severity as ancestral COVID, but with all our experience since then, we can greatly reduce the deaths because we've got all the extra tools. We know better how to use oxygen. We've got dexamethasone. We've got the antibody cocktails. We've got and then we've got these new things from Pfizer. That's got a tenfold reduction if you can get into vulnerable people early enough. We've got lots of tools that are hugely reducing the severity. So that's going to help with, and that is helping with the Omicron surge. And there's no real reason to expect, just as ancestral evolved to Alpha and to Delta, then it is possible that Omicron, so somehow Omicron has missed out on all the evolution since spring to summer 2020. One explanation, it's got some changes in the genes which are only seen when you put COVID into rodents, and then rodents infect each other. And so one hypothesis is that it spent a year living in a population of rodents somewhere. It's probably not South Africa or Botswana, because it didn't start there. It's the earliest cases of 5 delegates who got to Botswana from some other country. Botswana is not disclosing the countries of origin because of the travel restrictions that were added to South Africa and Botswana. They don't want to get another country in trouble, but they do disclose that some of the delegates came through Europe. So it's not impossible, for instance, they started a rodent population in Europe with much less, with gaps in the virus genome surveillance, because we still got lots of big gaps. And Botswana and South Africa detected it early because they had reduced cases of Delta. They had very few cases of Delta, and amongst that, it's very easy to sequence lots and lots of cases, and they also could spot the unusual symptoms in Omicron compared to Delta, and they could test them quickly, and that's why they found it first. It's not because it originated in either Botswana or South Africa. Both are quite unlikely countries for it to originate, because it surged there from very few cases, and the first few cases started in Botswana, so it probably started somewhere else. And it's been there for a year, and then it's back to humans, or it's the other possibility is an immunocompromised person who has just had it in just one person for a year. Another possibility is a very remote tribe. Not impossible, an uncontacted tribe in a tropical rainforest, say, could have COVID for a year and have hardly any visitors. But it's not a very likely scenario, but it's not impossible. And then someone goes and visits them and then brings it back to the rest of the world. And they've just been incubating COVID getting more and more transmissible ever since ancestral, but it hasn't got more severe for some reason. So those are the three main hypotheses. But anyway, now it's back with the rest of us, then it may well follow a similar path of evolution, no reason why not, where it could get more severe, like Alpha and Delta. So we could get future waves that are more severe. However, what we've got going for us, we just don't know. It could go more severe or less severe. We've got no way of knowing. But don't believe those people who say it's just a cold. It's not just a cold. It's about the same as the original COVID, and it may get more severe, it may get less severe. We don't know. But so we very likely do get more variants and more surges after Omicron. However, Omicron may help to tame whatever. So if this, so yes, I'll underline what I'm talking about. It'll help. So may help to tame whatever comes next. I forgot to do that with the last section. So the vaccine, because we've got so much more vaccination, and because we've got natural infections for most of the people who haven't been vaccinated, and people who are anti-vax, then most of those have probably already been infected. Because if they're anti-vax, they're probably also not taking much care to prevent themselves getting COVID. And some of them, sadly, regret not being vaccinated when they're in hospital. But that's already happened for those anti-vax people. So what we've got are the vaccinated people, and we've got the anti-vax people, and the anti-vax, and then we've got the people the vaccine hasn't got to because of vaccine inequity. And most of the people who it didn't get to, and including the anti-vax people, a lot of those people will be infected with Omicron, or they've already been infected previously. So in future waves, then they very likely have at least some immunity taking the edge off it. And so it doesn't mean the natural infection did not protect them. They were not protected by Omicron. It's about equivalent to the ancestral, and they are not protected by Delta. But the ones, some of them would have died, and the ones who survived dying are now more protected than the ones than they were before, because they survived dying. So basically, if you get natural infection, you get protected by not dying. If you are a lucky one and doesn't die, then you have a lower risk of dying the second time, and even lower risk the third time you get infected. So we get lots of anti-vax people being protected by being the ones who didn't die when they were first infected. So that's very sad, and if you know anyone who isn't vaccinated, then try to connect them to good information. But this will mean that with future waves, it's likely to be less infectious. But there's not very high confidence in that because the science is still being worked out. But it's likely, but sort of medium confidence or something, if you use the IPCC type of language, that with each peak that we get fewer deaths because of but the big vaccine rollout will help hugely with that in the countries like Africa, where there's less than 5% vaccinated. And what's happening in 2022 that will make 2022 different from any of the previous years is that we've got Novavax already for COVAX, and they have COVAX as their first customer, the first vaccine to have COVAX as their first customer, as their top customer. So COVAX gets the first batches for Novavax, and that's very different from Pfizer, where they get the last batches. So that's going to make a huge difference to vaccinating the whole world, because it's not just Novavax. We've got dozens of vaccines in phase 1, phase 2, phase 3. And the World Health Organization, they had this idea for a multi-vaccine trial. And this trial, this would have been a very good way of doing the vaccines in 2020. It could have let us get the results in half the time with a tenth of the risk of people getting the disease, because there would have been maybe more than 10 vaccines and one placebo group, and them all compared against them. And because they don't have to have a placebo group for each vaccine, then that halves the time, nearly half the time. To reduce the time by nearly 50%, because they've only got a tenth of the group or less is placebo, instead of half of it being placebo. And they could also have directly compared all the vaccines with each other, so we would know, because they're all tested in the same populations throughout the world, like the Solidarity trial of drugs. And so we would have been able to say definitively that, for instance, AstraZeneca and Pfizer, which one gives most protection for which age group. Is one of them better for children? Is one of them better for adults? Is one of them better for pregnant people, pregnant women? Is one of them better for immunocompromised, and so on? And we would have had good data for that. But sadly, they didn't manage to get that to happen, but this is happening now with the next generation of vaccines, which are being funded by CEPI, and they're being funded, and they're being bought by COVAX, and World Health Organization behind them, and then we've also got the weaker economies. And this also means that they can be sold at prices that the weaker economies can buy them for. So this is a huge, huge plus compared with previous years. And this means that the vaccines, we can make much more. So AstraZeneca was the only company of the early vaccines that transferred their technology before their vaccine was even approved. Early in 2020, they already worked with the Serum Institute in India, with South Korea and other vaccine producers, and with Brazil and others, so that they could make their own AstraZeneca vaccines. And even before it was approved, and they already had made lots of vaccines in all these countries before, apart from the Brazil one that came later, before the AstraZeneca was even approved, before they even got any results. And so that's why AstraZeneca was able to vaccinate so many people so quickly, and why it's the one that's used by COVAX, and why COVAX was able to access large supplies of AstraZeneca. Pfizer and Moderna did not do that. They could have done that, and they just did not. And so if Pfizer and Moderna had done that, then we would have had Pfizer and Moderna vaccines made in India by the Serum Institute, which is one of the world's biggest players in vaccine manufacture, and the whole world would have had many more Pfizer vaccines. And they could still have sold them for high prices to the stronger economies. And it's very hard to understand why this didn't happen. It's extremely strange. And the World Health Organization have been calling for this ever since before the vaccines were approved, before Pfizer was approved. The World Health Organization was calling for this. And it just wasn't done. But the World Health Organization now are in the driving seat, because what has happened is the stronger economies, they're hogging all the supplies of Pfizer and Pfizer are not developing any new vaccines. They're still using the technology of 2020, which because that's what they did, what went through all the clinical trials, and to use new, but we've discovered many new ways of making much better vaccines in the last 2 years. But we've got to start the clinical trials from scratch, from phase 1 for those. And Pfizer and Moderna are not doing that. Oh, sorry, the author did that by mistake. But Pfizer and Moderna are not doing that. And that's why all the new vaccines are being developed by companies in the weaker economies, including the Serum Institute in India, and for instance Brazil, Turkey, Thailand, countries you don't normally associate with making vaccine. Well, Brazil you do, but they are all making, and I think Mexico, lots of different countries are funding this, and then CEPI is funding lots of vaccines. And so and then you've got 4 of them in this multi-vaccine trial by the World Health Organization, which is which will be a very good way of doing it. And the World Health Organization is looking for 2nd and 3rd generation vaccines. And so they accept candidates that have promise to be more effective, or to be stored at higher temperatures, or easier to vaccinate. And this includes, for instance, one of the ones they're very likely to include, which has just completed phase 1, is Codagenics, which is a nasal spray, live attenuated vaccine using modern technology to re-encode the virus, the RNA virus, in such a way that it can only replicate very slowly. This also means it can only mutate very slowly. So it's a very safe, live attenuated vaccine with numerous changes all the way through, which it's very difficult for it to change any of those changes, which would need to change lots of them in order to become a vigorous, active virus. And it's past phase 1, which was done in a quarantine facility, so there's no risk of infecting anyone with it, just in case they got the calculations wrong, which they did not. And this is a likely one. It's going through phase 2. It's a likely one to go into, in fact, it's a phase 1, phase 2 trial anyway. I'm not sure what the situation, but it'll soon go into phase 3. And there are 4 vaccines they've already got. They've got high promise to be the next generation. Now, the good thing about the Codagenics, why I mentioned that, is that it has got mucosal immunity. You spray it into your nose, and it helps to trigger the IgG antibodies in the mucosal membranes. And this means they can stop the vaccine before it gets into your body. And it also means that it's stopping the vaccine in the very place where you would infect other people. So it's likely to be very effective at stopping transmission. Now, to be optimally effective in stopping transmission, we want to stop all 3. We want to stop the mucosal immunity, we want mucosal immunity, we want to trigger normal antibody immunity, the IgA antibody immunity, and we want to introduce T-cell immunity. And we've got different vaccines that do all those 3 things. So another one, very interesting one, is for the T-cell immunity, is the Gritstone Bio. And T-cell immunity is particularly useful for stopping severe disease. And with T-cell immunity, then what it's doing is looking around your body for cells that have been turned into virus factories. They're utterly useless to your body now. All they're doing is making virus. And those cells have inside them just loads and loads of innards of the virus. It's quite sloppy how they make how viruses make copies of themselves inside a cell. It's not like human machinery, but it's sort of a little bit like an assembly line. You have lots and lots of pieces that you make first. Make all the pieces, then you assemble them together to make a car. Except that in the cell, they spontaneously self-assemble pretty much. And so so when you have the T cells, they come and they sniff around and they spot this cell which has got which doesn't smell right. And basically what they look out for are the innards of the virus as it's making itself. The antibodies stop it entering the cell by looking out the exterior, and particularly the spike protein it uses to get into the cell. But the T cell immunity, they look for the innards of the cell. And Gritstone Bayer looked at certain things in the innards of the virus that don't change, not only through all the variants, even through other coronaviruses. And so they looked at these things that don't change very much, and they made a vaccine based on those. And so these are called the T cell epitopes. And out of 146 T cell epitopes targeted by Gritstone Bio, then only 3 were evaded by Omicron. And they are actually going to take account of those 3 because they haven't yet gone into phase 3, and they're going to do that phase 3 trial actually with an addition to take account of Omicron added to what they're doing already. But it's only 3 out of 146. So it's likely to do very robust T cell immunity against all possible future variants. And then on the antibodies, a very interesting development there is a vaccine by the US Army, which puts 20 odd different spike proteins, which can each be different from the other, all on a single kind of protein and other things core unit that they make. And their one has their one is just finished clinical phase 1, and they say they had good results. It hasn't been yet published. It should be published in the next few days. And this vaccine, so you might well get news about that when it's published. And there were minor news stories already about it. I read the news story in research I was doing, looking to do with military situation, to do with other things I was helping people with. And it turns out that the military had an article in one of the magazines about this vaccine that is just about to publish the phase 1 results. And it has several spikes for different variants of COVID. And they also have several spikes for different variants of SARS, all on the same vaccine. So they hope that this vaccine will protect you against COVID and SARS simultaneously. And an early version of, not their one, but one of the ideas they built on, actually protected against not only I think SARS, I can't remember what it was, but not only things it was meant to protect against, it also protected against one of the common cold viruses. And it's a bit mysterious why it does that, but it seems that if you present the immune system with spike proteins, multiple spike proteins, then it not only develops antibodies separately for each one, it's somehow able to generalize and say, I see a pattern of those 2 spikes, and it generalizes that to make an antibody that works against things it hasn't seen yet. So in all this, the vaccines, most of the cleverness in the vaccines doesn't come from the humans. Most of the cleverness and the amazing protection you get from vaccines comes from your immune system, which evolved over many millions of years and thousands of millions of years to protect us against diseases. So somehow, when it's given 2 different spikes that can be very different from each other, it's able to generalize from those and say, I see a common pattern to those, and make something that will help it to protect against something it's never seen before. So this idea of multi-spike vaccines may well introduce very broad spectrum immunity, not just against vaccines known, but against future vaccines we don't know yet. And it's possible that already happened to people who have been infected with Omicron who were vaccinated against ancestral, or the people who were infected with Omicron and Delta. Or if you were vaccinated, got Delta and got Omicron, I mean, you'd have most of all very broad spectrum immunity, probably. Though being infected isn't so consistent, and that's the main reason, advantage of vaccine. And definitely, if you've been infected, to help you, it greatly improve your immunity to get vaccinated as well. So do get vaccinated, even if you've been infected. And so, with all this coming along, and it's going to be going through COVAX, and so that means that it's going to be a fair distribution, unlike the 2021 distribution. The 2022 vaccine distribution, the very best vaccines. So by the end of 2022, we're not going to say, I wish I could get a Pfizer vaccine because it seems to be the one that gives the best data, which is in fact the case. Pfizer and Moderna seem to give the highest level of protection. But AstraZeneca give pretty good protection. They all give very similar protection against severe disease. But if you go to the end of 2022, you may well say, I want to get Coologenics or Gritstone Bio. These names that most people haven't heard of yet. But it's quite likely, we don't know that they'll all be approved, but it's quite likely, given the tremendous level of success that there was, and we don't know that they will all introduce this high level of immunity and a broad spectrum immunity, but it seems quite likely. So we won't know until they complete the clinical trials. It seems quite likely they will. And then we have the new Pfizer vaccine, the new Pfizer therapeutic. That's the most exciting of all the discoveries in terms of science of the therapeutics. That it introduces tenfold protection. The Merck one isn't so clear data. It's definitely protective, but the Pfizer one was absolutely amazing. Tenfold reduction in hospitalization if you give it to the first three. So Merck is better than dexamethasone, but it's not quite the astounding results of the Pfizer one. Whatever you call them. And the Pfizer one, it's a funny name, I can't remember it now, but we'll probably all know it quite soon, like dexamethasone. And this, no, I better not try and remember it, but this drug, if you give it to vulnerable people, it's only been tested on vulnerable people, in the first few days of infection, when they've just had symptoms, then it greatly reduces their risk of going to hospital at all, tenfold. That's a rather an astonishing thing. And the way it works is generalizable to other diseases. They might well do it with flu, because the way it works is it interferes with the way that the virus makes copies of itself. And it doesn't introduce errors into the RNA, it works at an earlier stage. So that was the issue with the Merck one. But with this one, it uses a specific part of the process that is specific to COVID. So it's not going to mess with anything else. And it interferes far too early to just introduce errors into the virus. It just stops it replicating altogether. And it's the first of these new drugs that are purpose designed to COVID. And it was very effective. And there are many more, these small molecule drugs, not very complex, not that difficult for the weaker economies to make. Apparently it's within their range to make it, and they're in negotiations, and they have I'm not quite sure what the stage is, but they're going to license it at affordable prices to weaker economies. So this is going to be widely available as gradually. At the moment it's really short supply, but towards the end of 2022, then that new one, Paxlovid, just pops into my mind. Is that what it's called? Anyway, whatever it's called, it's going to be widely available at the end of 2022. And there are many more, there's several hundred of them, of these new therapeutics coming in. So if you think about that, tenfold reduction with me, with the booster, I've got a 20-fold reduction of dying, of the risk of dying. And it's likely with the next generation of vaccines, it'll be much more than that. And then so that's like my 100-fold if it was before, it's now on in 2000. If I get infected, I've got all these other layers to stop myself getting infected. Now, if you add to that Paxlovid or whatever it is, or the new, I may have got the wrong name there, that is one of them, but I don't know if that's the right one. But whatever it is, then when it may well be that if I get symptoms towards the end of 2022, if I do get COVID, I get symptoms, then they give me this in the first few days. I go to the doctor and say, oh, I've got symptoms. He tests me and says, oh, yeah, that's, and it turned out positive in LFT. So the doctor, he or she, said, oh yes, and you need to take a couple of tablets of this thing, and take that for the next 3 days, and then you have a greatly reduced risk of hospitalization on top of the risk you had, the already reduced risk because you had the booster, and then I've had another booster of a second or third generation vaccine. So in that way, by the end of 2022, then your personal risk is going to be very, very small. And then on top of that, if you've got something like codogenics, and they might well do something like the MMR vaccine. Imagine the best protection would be maybe the army vaccine, the codogenics, and the Gritstone Bio. And you could have a triple vaccine with all those three in one vaccine, just like they do with MMR, and then vaccinate people with all three. And they would have superb T-cell immunity, superb antibody protection with the IgA antibodies, which are like your second line of defense in your lungs and everywhere, and they have superb IgG immunity as well, mucosal immunity, through the codogenics nasal spray. You would give them a nasal spray for the codogenics, and then you give them, it might be by then they can all be done by nasal spray as well. I don't think those have been developed as nasal spray yet, the other two, but that's something that's being looked into more and more now as well. It's almost force of habit that we're used to injection as a way of vaccination, but nasal sprays may be where it's going with vaccination in the future, that maybe we have more and more use of nasal sprays. The science of vaccination has gone forward hugely with COVID-19, and so it's because of all these things that the World Health Organization are very optimistic for 2022. They were optimistic for 2021 if we were to keep cases down and if we were to solve the problems of vaccine inequity. And I don't think anybody quite expected in 2020 how much vaccine inequity would be in 2021, how difficult it would be to reach even 5%, only reach 5% vaccination in Africa, although the world has enough doses to get 40%, even in stockpiles. We have 1.6 billion doses in stockpiles around the world, according to Air Infinity. And that would be plenty of vaccines. You could get the first vaccine dose to everyone in Africa and have half a billion to spare with that. Everyone, including the kids. And if you look at the 70%, then you would have nearly a billion to spare after doing all that. And so just from vaccines in our stockpiles, we could vaccinate Africa. And it's very difficult to understand why countries like United States, England, United Kingdom, Europe, so on, why we have such huge stockpiles. United Kingdom, I think it's about a month's stockpile. It'd be much better to have just a week or two of stockpile, and the rest is in the arms of unvaccinated people in Africa, because that's where it's needed. And the way you would do that is swap, a vaccine batch swap, so that the next 2-3 weeks of vaccines we don't need them. Let our vaccine stockpile go down to 2 weeks. And for the next 2 weeks, let all our batches go to COVAX instead of stockpiling them. And instead of maintaining a 30-day and increasing stockpile. That doesn't really make much sense, since the world is affected together, and we can. And if most of Africa was fully had their first dose and then their second dose, then vaccine Africa could keep cases down, deal with Omicron surge, end it faster, keep cases down faster. That would mean the next variant would come along later, because the fewer cases, the more people have COVID. Remember, every COVID case comes from a previous COVID case somewhere, and every variant comes from someone somewhere. If you can cut chains of transmission, then you reduce the probability of the next variant, and the more chains you stop, the less variant, the longer you have to wait for the next variant. So if the next Omicron variant, without vaccinating everyone in Africa, comes along, in the middle of, was going to come along in a couple of months, it might be a couple of months after that, if we could vaccinate everyone in Africa and in the other unvaccinated places where the vaccines haven't got there yet. For instance, say Mexico, where they are just a neighbour to the United States. The United States has a huge surplus of vaccines, Mexico doesn't. And so if Mexico could have plenty of vaccines, and then they could surge up and vaccinate everyone, double dose vaccinated and then boosted, and double boosted even like Israel, and they'd be in a much better situation. And what good does it do to the United States to have huge stockpiles of vaccine and to have Mexico on their border with many people unvaccinated? That does not make any sense. That is not a sense. No, that's not rational. And so the United States should be running its stockpiles down to the minimum it needs for operational purposes. And it should be swapping batches with COVAX and with Africa and with Mexico. So you can have our batches for the next 2 or 3 weeks, and we'll run our stockpiles down. That would be much more sensible than sending donations of expired doses just before they're about to expire. Because that is very difficult for a country to make use of, because they have the same problem as you have. They've suddenly got to get them into people's arms with very little notice. So anyway, if we could end it much faster in 2022, if we were to solve the problems of vaccine inequity, and if we were to aim to reduce transmission, and instead of living with the virus for a few more months, we were to be more careful about the easily used public health tools like wearing masks, physical distancing when you don't need to. There are many situations where people crowd together and there was absolutely no need to. And in many situations where you can wear a mask, there's absolutely no reason not to wear a mask. People in the underground don't need to see your smile. It's far better for them to be protected from you with a mask. And in schools, then there's no good evidence that wearing masks impairs learning. And people in the United Kingdom is very rare, and Scandinavia, they seem to be convinced that, and both opposition and the governing party are behind this idea that not wearing masks in school, but they're also not doing ventilation in schools either. All very hard to understand. We should be doing everything we can to protect the school kids from getting COVID. And that will help them, because the school kids are themselves are incubators for new variants. They are in between nodes on transmission chains, which can eventually lead to new variants around the world. They're leading it to other people. If we can stop transmission in schools, then it'll make a big difference in increasing the time until the next new variant. More masks, more ventilation in schools. We not only protect people in those schools, We not only protect the children from long COVID, we not only protect a few, very minority of children from dying, but we probably help to delay the next variant. So it'll come maybe a few weeks, months later, even a few weeks later, you have more people vaccinated and boosted. So we can do a lot to end it faster in COVID in 2022. If not, we still have the amazing science coming along. Now, just one final thing to put this all in perspective is that many people, I get contacted by people over and over and over again saying, I'm very scared, they think everyone's going to die of COVID. They literally think that COVID is going to make humans extinct. And this is due to clickbait headlines. And journalists, even if you go to the top of this story, then if you imagine reading this headline, and I'm a responsible journalist, I'm not saying they're a bad person, they're just not very well aware of how these headlines appear to vulnerable, psychologically vulnerable people. And they look at that and they say, Omicron cases are exploding. It's natural for a journalist to choose a very colourful word that will very clickbait. That's clickbait in a good sense in a way. No, it's not clickbait because there isn't any bait. It's click amplification. More click amplification. There's no bait. Well, there's bait in a way, because it doesn't say the cases are exploding in a literal sense, but they're very rapidly increasing, and they are. It's metaphorical, and they don't know how bad the wave will be. Still don't know how bad the wave will be. Well, for the people that I help, they don't know how bad the wave will be. Means they don't know that it won't make everyone extinct. That's how they read a headline like that. So they're terrified by headlines like this. They need to be more explicit. If they want to be less scary, then they need to be more explicit. They don't know if the wave may lead to high levels of hospitalization for a few weeks in January, with general care overwhelmed. But if they said scientists still don't know if the Omicron wave will lead to high levels of hospital care in January in general wards, that people wouldn't click through to that. So it's natural for journalists to say something like they don't know how bad the wave will be, kind of vague and ominous and scary. That's how it appears to the scared people. But that's not the true situation. It's what I explained, which is explained properly in the article. The subtitle is more accurate. Early suggests new variant may cause less severe disease and death, but hospitals are stretched to their limits. So that could be in the title. Omicron cases are surging fast, but the new variant may cause less severe disease and death. However, hospitals are stretched to their limits. That could be in the title, but nobody would have clicked on that title. So you need to be aware when you're reading these journalist articles that they write scary titles that are not actually, they are hyperbole. Like when you say, I could eat a horse. You couldn't literally eat a horse. And people may even add, I could literally eat a horse. But when someone says, I could literally eat a horse, that's a very clear sign they couldn't. And it's very like that with these headlines about COVID. It suggests it will be deadly, but it is not. It's not going to be in the sense of killing everyone, or even killing most people, or even killing as many people. So a good comparison to help understand that it's not deadly in that sense is to compare with the 1900. If you go to a typical year in 1900, it would take me a minute or two to bring up the chart. You may have seen it if you've seen my previous videos or my article. I put my article about where COVID will evolve into the video description and some other, and the links to the tweets, and I will add a link to this article, and so you can find that graphic there. And if you look at the typical cases in 1900 from infectious diseases, that included HIV, included TB, which is now not a problem for us because of antibiotics. It included smallpox, polio, measles, and flu deaths were far higher than today, they weren't able to treat them with the sophisticated ways we can today. If you look at all those deaths, and now you look at all the deaths you look at deaths for a non-pandemic year in 1900. And now if you look at all the deaths from COVID, from the very beginning of the pandemic, and you look in both the United Kingdom and the United States, which are amongst the worst hit countries in the world, then all the deaths from COVID, in deaths per million, were a little over 100 days of deaths in a non-pandemic year from infectious diseases in 1900. So if you could move a 1900 person in a time travel, in a time machine, to 2021, to the middle of the pandemic surge, of the Omicron surge, or now January 2022, the middle of the Omicron surge, they won't be going, look at all the deaths, look at all the, they would be going, isn't this astonishing how few people are dying of infectious diseases? It's absolutely extraordinary how medicine has moved on since my day. We haven't got people dying of tuberculosis. We haven't got, smallpox is gone. Isn't that astonishing? They don't even have smallpox at all. Polio is hardly anywhere. There's no cases of polio in United Kingdom. How is that possible? There's no cases of measles. Go to the hospitals, there are no children in there with measles. And then you discover there are a few cases of measles. If you could get a doctor from 1900 to the 2021 and take him to our hospitals, and he'd be going around to say, where's the TB, where's the smallpox, where's the polio, where's the measles? And they're not there anymore. And then he's saying, well, you've got this COVID, but look at all the way you're treating them. Look at your treatment. You've got this. We never even knew that you could use oxygen as a therapeutic. And look at all these amazing drugs you've got. And then you've got these vaccines, and we haven't even heard of. We didn't even have vaccines. So you can actually stop people from getting this disease as well. And they would be absolutely astonished by our medicine. But if we look at our medicine, where it's going forward to the future, to 2030. And remember I was talking about we've got these therapeutics that can even stop you from going to hospital with flu probably. They're using them now for COVID, they're probably using them for flu. We've got the possibility now with flu, we have very good vaccines for flu, but they're not nearly as good as the vaccines for COVID. They're only 40-50% effective, and then flu is very non-transmissible. It's only a little bit, it's above 1, but it's well below 2. So if you could have a 50% vaccine that was 50% effective at stopping transmission, but sadly the influenza vaccines, the flu vaccines, they are good at stopping you from getting sick with flu. They aren't very good at stopping you from infecting other people with flu. But if we can manage to develop a vaccine for influenza that's good at stopping transmission, we could end flu. Really quite easily, because it is really not very transmissible. And not in the R number, it's only about R1 or something. Now, there's just one other thing I'm going to say about this. They don't know why Omicron is spreading so fast. Let's look for super spreading. Yes, this was an interesting thing from this article as well, I want to remember. It might be much easier at causing super spreading events. And then I'm not sure if it'll take a while to... Yes, there we are, this is the paragraph, I just want to mention that as well. And if it's causing milder disease, then the people who shed virus might be out and about a lot more because of fewer symptoms. And if so, banning large gatherings, including down nightlife and restaurants, might be even more effective at slowing the spread of Omicron than previous variants. So that's one thing that may possibly be later countries to get these Omicron surges, that would include United States, and if they go and look at what's happening in Europe, then this is one way we may be able to slow down and stop the Omicron surge, reduce the Omicron peak from being quite so much. We can actually remember each of these cases, each of these things is blocking. So it's just for a few weeks. Sadly, we may have to close down and nightlife in restaurants and banning large gatherings for just a few weeks in January. And that may help flatten out this peak and eliminate some of the cases altogether. And it's not just slowing it down. A lot of people say, oh, we're just flattening the peak, it's the same number of cases. It's not necessarily. A lot of these people who are still being vaccinated, still being boosted, if you can slow it down, the Omicron surge, by closing down banning these large gatherings, nightlife and restaurants for a few weeks, then we can be saving people from dying, because when Omicron gets to them, they will by then be well vaccinated, and remember you've got to have a week or 10 days after the vaccination before they are protected. So the more we can slow it down, then we're stopping the transmission, we're stopping the new variants beyond the rest of the world as well. So I just want to mention that as well before the end of the... So we've got so much we can do to slow down and stop transmission. For yourself, I just bring up this Swiss cheese. Do continue to use all the layers of the Swiss cheese layer as to the abilities that you can. So as it is wearing a mask, you can use almost everywhere. There are very few situations where wearing a mask will impair with your ability to do what you're doing and your ability to communicate. In terms of communicate, remember you can smile with your eyes. You don't need to only smile with your mouth. And then, research shows that people are smiling with their eyes more as a result of the mask wearing. When you wear a mask and you smile for a photo, you smile more with your eyes. So try and look out for that in other people and try using it yourself. And generally, you can use things like name tags if people are finding it difficult to recognize you with your mask on in a situation where that's appropriate. And generally try to learn, and then use transparent masks where you have to deal with people with who have got hearing impediments. And generally, so wearing masks, there's ventilation, there's physical distancing. There are many situations. Try and look at the situations and ask, do I have to be close to these other people in this particular situation? And if you don't have to, then say to them, I'm distancing and I want to step back. And most people will recognise that as a valid thing to do. And try to make it automatic, like when you cross the road, you look both ways for traffic. And if you're in a situation where you can distance, and say, I want to distance and step back. Just say that to the other people. Most people will accept that. And just to take every measure you can to break chains of transmission. And it may be that you still get COVID, but you may have delayed it by a few days, by a few weeks before it gets to you. You may have blocked, if you've done that, you've blocked lots of chains of transmission. You've helped turn the trajectory. You've helped delay the next variant. You've helped to reduce the next peak, whenever it is. You've helped to reduce the peak for Omicron. You've helped to Omicron to descend after its peak. And in your community at least, and in the people that they interact with, and through them to the rest of the world. So we are not powerless, we are very powerful in this situation. There's a huge amount we can do to help end the pandemic ourselves, and then with this material, then we can also we can bring to the end of COVID, and then we're going to end polio in the next few years. That's pretty certain. We're very, very close to that. We've now got the new inactivated polio virus, not inactivated, the attenuated polio virus has been a vaccine that's an attenuated virus that's been developed with the funding of the Gates Institution, which is the replacement for Sabin's vaccine, which is the only of the polio vaccines that actually stops transmission. The Salk's vaccine stops the symptoms, it doesn't stop transmission. The Sabin's vaccine stops transmission. And by that we can end COVID, we can end polio. And with combination of this new version of which is now being used in the place of Sabin's vaccine, then we can do it without the risk of it reverting to severe polio. So that is on its way. In a few days, a few years, we will be rid of polio, pretty much for sure. And then we also have many other eliminable diseases and a huge expanding vaccine capacity. The World Health Organization, I was talking about the mRNA vaccines, the World Health Organization vaccine hub in Africa is developing new mRNA vaccines that are going through the phase 1 trials, phase 2, phase 3, and these mRNA vaccines, these new better vaccines, and they will be able to use them not just for COVID, but for many other diseases. And so we're going to have a situation of vaccine equity, but not only that, vaccine innovation, where Africa can make its own new vaccines, and where Turkey can make its vaccines, Thailand, Brazil, India, South Korea. They're all going to be making their own vaccines with new technologies, with the mRNA. It's hard to remember now, but before 2020, there were no mRNA vaccines. I don't think there were any at all. Was mRNA technology was being used. I think that was the first vaccine. Correct me if I'm wrong. And we've got the subunit protein vaccines like Novavax. We've got the vector vaccines, like the adenovirus vector vaccines like AstraZeneca. And that technology is being spread to hubs throughout the world with the help of World Health Organization. And so by the late 2020s, we're going to have vastly increased vaccine capacity. Every country, everyone who wants to be vaccinated against any disease they want to be vaccinated against, they will have fair and equitable access to these vaccines, just like we are used to in the stronger economies. And with this background, and with good public education, and with a good vaccine program, then there are several diseases. And malaria is gradually being eliminated from one country after another. By the end of this decade, we've probably got rid of malaria. And we've got many other diseases that are being eliminated as a public health issue for humans. Some can be completely eradicated. We can't eradicate COVID because we've got animal reservoirs. We likely can eliminate COVID with a good enough vaccine, a 95% effective vaccine for COVID. And we may get that with that combination of the 3 types of immunity. Then that will be enough to be able to eliminate COVID. It'll become an eliminable disease. It already is if you're permitted to add health measures on top of the vaccine. Because if you imagine a parallel world that in 2020 had China and Australia and New Zealand. Imagine like the dolphins, and they moved the world into a parallel world, like in Hitchhiker's Guide to the Galaxy. Imagine the entire world was moved to a parallel world. But instead of moving all of us, they moved, it's not a real thing, this is fictional. There isn't anything like this in reality. So please don't be scared of parallel worlds. But it's a very interesting imaginative fictional device. So imagine we had a parallel world, which is an ocean world. And then we moved a complete ocean with dolphins living there and all of our marine life. But then they only moved China, New Zealand, Australia, Thailand, Taiwan, Tonga Islands and Bhutan, and a few other countries I've probably forgotten. And they moved all those to this parallel world in 2020. Then they would have had no COVID. They would have eliminated COVID in 2020 with over 1 billion people in just China and the rest of the world too. And China is far too connected to the rest of the world. It is not hiding an outbreak of 1 million people dying of COVID. The people in the stronger economies, the people who've got wives in China, people who know health workers in China, and this world is far too connected for China to be hiding an outbreak. And so China isn't having millions of deaths. So if you imagine that parallel world, then it would be a world without COVID by March 2020, or maybe April 2020. There will be no COVID in the world. And so COVID is, and these people these countries are still keeping out COVID, apart from New Zealand, Australia, but the other ones are. And New Zealand, with a good enough vaccine added to its measures, it may well go back to have eliminated COVID again before most of the other countries in the world, because they are used to not having COVID. And so with a good enough vaccine, enough people vaccinated, extra health measures, it's possible for countries like New Zealand to go back to being eliminated. So it could be eliminated already with the vaccines we have already, plus public health measures. But if you look at eliminating without a vaccine, it needs a 95% effective vaccine. Then in between that, you'd have maybe 80%, 90% vaccine or something, 80% effective vaccine, say. Then if you add to that the test, trace, isolate being rigorous, small outbreaks and surge testing, then that may be able to make the difference between completely eradicating it and living with it. And so do bear in mind, it's a choice to live with it. I don't think it's a good choice. And I think we could have eliminated Delta in the United Kingdom if we'd combined it with very rigorous contact tracing, continuing. But anyway, we'll see. I won't go into all that. But so the situation is looking very good, though, that by the end of 2020 we will have a very much better situation where your risk of dying, if you've been vaccinated, if you're sensible enough to get fully vaccinated, boosted, and then get boosted again with a second or third generation vaccine, and then if you accept the drugs that they have by then, the therapeutics, as soon as you're mild, you go to the doctor and the doctor says take these drugs. You don't say, oh, I'm not going to take a drug. I don't believe in doctors. I'm going to go and play tunes, play nice tunes and listen to wind chimes and look at the crystal, and that's going to cure me of COVID. If you are willing to get drugs to cure your COVID, once you've got your but if you do get infected at the end of 2022, and if you're willing to get vaccinated and boosted, then your risk of COVID by the end of 2022, you will have access to vaccines, even in the weaker economies, and your risk of dying of COVID will be hugely, hugely reduced compared to today. And so in that sense, that's why the World Health Organization, they are being justly very, I fact check what they say, I fact check what other people say, and the World Health Organization are very accurate, and they always, whenever I fact check them, then they pass the fact check, and I go and check their sources, and they say exactly whatever Dr. Maria Van Kerkhove says. And when it's something important, then I go and look for the papers she's talking about. They say exactly what she says. She doesn't sugarcoat them. She doesn't make them say the situation seem to be better. She doesn't make the situation seem to be worse. She describes the situation exactly as it is. And if you want to have a good overview of the COVID situation, listen to the World Health Organization live Q/A's question and answer sessions. They are excellent once a week. And listen to the World Health Organization press briefings. They give by far they give very, very accurate. I won't go as far as say the most accurate, because there are some other sources that are very accurate as well. But they are one of the most accurate, one of several sources that are very, very accurate. They are extremely accurate sources on COVID. I recommend you follow them, and they have changed in just especially since Novavax was approved just before Christmas, and they're coming to this very, very positive situation where they see that 2022 we can end this pandemic, and we've got so many science, basically because of such good science tools. And please, please don't be scared, and this is the situation will be hugely changed by the end of 2022. And I know I said at the start of 2021, this is the year when we can end COVID. I was following the World Health Organization. I didn't expect the fast vaccine equity like they didn't. I didn't expect the choice to live with the virus that England made with Delta, to let it just surge and surge and surge and continue surging all the way to Christmas. And then the Omicron on top of it. The Omicron, they expected variants, but they were telling the world how to delay these variants and stop them and slow them down. And Omicron mightn't have come until 2022. So that's why many people were saying, so many people who follow the World Health Organization, and like myself, I was amplifying their message, saying 2021 is the year that we can end COVID. And sadly we didn't. That was a choice of politicians. And I'm not blaming the politicians because they have a different way of thinking. They don't think like scientists. It's very, very difficult for politicians to do tough measures to prevent hospital cases 2 weeks later when they haven't yet happened, because if they take these measures, the hospital cases won't happen, and then they will get all their critics saying, look, you use these very harsh measures, or even just you told everyone to wear masks, and we don't believe in wearing masks. And so they will say, look at all these things, you've made us wear masks for 2, 3, 4, 5 weeks, and nothing happened. And that's the big dilemma that the politicians end up in, that they, by getting everyone to wear masks, they're stopping hospitalizations a month later. But when the month happens and there aren't any hospital cases, then everyone tells them, but look, there's nothing happened. So they have been doing boosters and vaccinations. They've been very reluctant to use masks, physical distancing, closing large gatherings, and so on. But hopefully, and then Omicron is surging very fast, and so that's been part of the problem for the politicians. So please be a bit sympathetic to the politicians as well, and don't, like for instance, looking at the United Kingdom, and you start saying, oh, the Tory government, they're so bad, look at what they're doing, they're just not listening to the science, they're doing yet another bad decision, another bad decision, another bad decision. They are politicians, they're responding to the public. There's no fault to the public at telling the politicians to do what they're doing. So you are a more informed member of the public, you listen to the World Health Organization, you follow the science, you understand that what the government is doing is not the best for you. What the government is doing is what the general public think is best for themselves, because they don't want to wear masks, find the masks irritating, they're very tiring to wear all day, and if you look around you can get better masks, wider, not so better fitting masks, and better for you, easier to wear, and you can get masks that are more effective. You get masks that are designed for hill climbers if you're a hill climber, so there's more space around the mouth so you can breathe more easily. So the many masks around, and to try and find a better fitting mask if your mask isn't working for you, and try and find one that's more suited to you, and but many people they just aren't aware of the science, and the politicians aren't very aware of the science. They're not presenting it as clearly as the World Health Organization and Independent Sage in the United Kingdom, and the gaps in what they say. You're not aware about how much transmission goes through schools, not aware of the importance, quite aware of the importance of masks, the importance of ventilation. So bear in mind, if you've been following my blog posts, you know these things. If you've been following the World Health Organization, you know these things. The politicians, well, their public don't know these things, and the politicians, then may not be very aware of these things, and they don't think like scientists. Boris Johnson doesn't watch every media briefing by the World Health Organization. Well, I'd bet $1 million that he doesn't, if I was a betting man, that he doesn't watch the heavy press briefing of the World Health Organization or the World Health Organization social media Q/As. So if you watch those, you're probably better informed than Boris Johnson. And so do bear in mind that the politicians are not always better informed. They're not scientifically minded. They are listening to other people. They are very politically aware, because that's why they're politicians. They listen to their public. They listen to their constituency. They are doing what a lot of the people in the United Kingdom want them to do. They were voted in, and they're doing what they were voted in to do. So please don't try and say, oh, the Conservatives are bad, Boris Johnson is bad. Please don't think of them as being bad people. That will not help you, that will not help anyone. Blame does not help anyone. Just think of them as being politicians doing what politicians do. And this is a very difficult situation. And some very strong, resourceful politicians, like in New Zealand, then they have been able to do things that go very much against even the basic instincts of a politician, do very strong measures. And they explain very clearly, Jacinda Ardern explaining very clearly to the New Zealand public. And she did things that very few politicians did. It takes quite a remarkable, strong-minded politician to do that. And as a politician who understands science very well, or so, for instance, Taiwan, then their deputy minister or something was an epidemiologist. In the case of Bhutan, which is one of the best performing countries in terms of fighting COVID, they managed to vaccinate the entire population in a week and a half. And Bhutan, then several much of their government is actually medical practitioners. And so that is why they have had one of the best responses in the world. So you have you have the politicians who are scientists, and in my particular view, in the United Kingdom, then Maggie Thatcher was a scientist, and she's very far away from my own personal brand of politics that I like. She's regarded as very far right. She was regarded as very far right in the United Kingdom, but she was a scientist. She was the first world leader on the global stage to draw attention to the climate change in the 1980s, way back in the 1980s. And I believe that if Maggie Thatcher had been the Conservative Party Prime Minister in place of Boris Johnson, then she would probably have given a similar response to Taiwan. I think she would have been on it very early on. And if Maggie Thatcher had been, I don't know for sure, she wasn't a medic, her specialty was crystallography and chemistry, but she was scientifically minded, she was very ahead of the curve with climate change. She was not ahead of the curve compared to scientists, but ahead of the curve compared to the general public. And she was ahead of the curve, I think that Maggie Thatcher would have been ahead of the curve compared to most politicians in the world, probably even compared to Jacinda Ardern, because she was a scientist herself. And she's known as the Iron Maiden. She would have had no hesitation in getting on a raw footing with getting tests throughout the country if that was needed, and having very rigorous test, trace, isolate. I think that Maggie Thatcher would have instituted a very rigorous test, trace, isolate system very early on. She certainly wouldn't have abandoned it. That's a very non-scientific thing the United Kingdom did in March. So it's not left-wing or right-wing politics. So please don't think this because we've got a right-wing government in the United Kingdom either that this has happened. It's because we've got a Prime Minister who is an Oxford graduate, who is a classic scholar, who could had a very good degree in classics, who could have gone on to become a classics don, and who has been a politician all his life, and who is not very scientific, and he is just doing as politicians do, and he continues to have a lot of approval of the UK public. Many people think what he's doing is right. So please don't blame Boris Johnson for just being himself and representing a major constituency of the UK public. But hopefully we are going to gradually learn from this pandemic, and we're going to gradually discover, countries are gradually finding out more about how to respond to pandemics, and we are moving forward. These things are happening. People are being generous. And just to say that the vaccines that we have in the rest of the world, and that's greatly due to, again, we need to express our gratitude to the academics. So there are many academics, again, like talking about Maggie Thatcher being a scientist. And scientists are less, not all of them, but the Texas University has licensed its made several innovations in the science of the vaccine for COVID to the weaker economies, and that is part of the reason why the weaker economies are able to make the next generation of vaccines. So please try thinking the other way to the generous people in the wealthy economies. AstraZeneca, which has given away its vaccine technology to weaker economies at cost, and that is due to academics. It's not the AstraZeneca company. It is the Cambridge University, not due to the UK government. It's Cambridge University. I got it right. The Oxford University. Which one was it with AstraZeneca? I think is it Oxford or Cambridge? I've got muddled. Anyway, the university made it a requirement for AstraZeneca that they, I think it's Cambridge. Do correct me again if I'm wrong with that. Anyway, they made the requirement with AstraZeneca that this vaccine is being distributed at cost in the weaker economies, at cost globally in stronger economies too, which is why it's the lowest cost, one of the lowest cost vaccines. And AstraZeneca transferred its technology early on, and so this is another thing we can be grateful for the Cambridge, the AstraZeneca, I think it's Cambridge University, the university requiring it to be distributed at cost and making no profit directly from the vaccine. And then we can also be grateful to the Gates Foundation. So Bill Gates, he has given away billions of dollars of his own funding to the rest of, specifically to fighting infectious diseases. And a lot of his funding has been used to fight COVID. So don't believe the infodemic about Bill Gates. He is not earning money from his vaccines. He is losing money. If you look at it that way, he sees it as the best investment he made when he looks at the effect it's had on other countries' economy. And it's been a big improvement, big financial benefit. It's giving away. It's far better than just giving money directly to another country. Is funding something that you believe in, you understand, and you look at carefully, and you target your investment to the very best sources. And that's what Bill Gates has done. He's used the same nous of investment to invest as leader of the Gates Foundation, to targeted investment to places where it's needed to boost the fight against infectious diseases globally. So he has been an important figure. There's been the governments that have billions of dollars of funding, and many governments have given funding to COVAX, and so they can buy vaccines, and they've been given funding to develop vaccines, to the World Health Organization, to SEPI, to delivering public health, to delivering the healthcare, the PPE, personal protection equipment, and making sure that the weaker economies have it. And they have donated hundreds of millions of doses to the weaker economies. So I talked about the stockpiles, but there's the positive side as well. So there is this positive side, and we need to encourage the positive, and we don't blame people for the negative. It takes a long time to change, and just continue to encourage all the positive things that are happening in the world. And if we'd been in 2019, gone to where we are in 2022, then we would have been astonished at the progress in vaccine technology that's happened, in the vast numbers of vaccines. And if you'd gone back to a vaccine, to an epidemiologist in 2019 and said that in 2022 there will be over 100 COVID vaccines in clinical trials, and we're going to be make all these discoveries and have all these new vaccines, they would have said, "You're dreaming. You're in a fantasy." If someone had made this into a movie in 2019, then nobody would have believed it. He said, "This person is being too positive. There's no way the world's going to do all those things." If we'd explained how the finance from stronger economies has protected the weaker economies, and that $1 trillion fund from the world, from the World Bank, I think $1 trillion fund, been used to protect agriculture globally. And if they talked about the COP26 and the improvements and things that happened there, and again, people said, "Oh, you're fantasizing, that's never going to happen." And if they made that into a movie, nobody would have believed the movie. They would say it's too good. So there's so many positive things happening, but the news is constantly reporting negative things. So I talked about that news story, and you get lots of news headlines like that. Scientists still don't know how bad the wave will be. They could have changed that to scientists still don't know how good the wave will be. Just one word change. If you just kind of recognise that, that's what they do with all the headlines. They about COVID, they flip them always in the direction of negative. I can't think very few headlines. Maybe the one about try and list all the COVID headlines you've seen, and try and look at any that have taken the story and tried to flip it into a more positive direction. And then look at the ones that tried to flip it into a more negative direction than what the story actually says. And this has flipped the story into a more negative direction. See, I've explained with hyperbole, and in order to drag your eye. And so I'm saying this is a good journalist. I'm not saying this journalist is bad. It's just instinctive. And it's just their article wouldn't have got views without doing that. But bear in mind, and it wouldn't have been shared so much if they flipped it positive. People wouldn't have believed it. But that's what's happening in journalism. And I think that we need a new code of journalism or something to change. This is happening a huge amount in climate change, a huge amount in COVID. That you go and look at the journals, 1, 2, 3, 4, 5, look at all the titles, and if you have this way of looking at them, this pattern saying, has this title been flipped flipped towards negative or flipped towards positive, then many more have been flipped towards negative than to positive. An interesting thing for someone to study as a sociology project, the extent to which what percentage of titles are flipped negative relative to what the actual story is, and how many are flipped positive by the title. So this was actually really quite a positive story, as I've explained, especially looking at the long term, but the title doesn't make that clear. And so when you read all the titles about COVID, because I get people who get very, very scared, and they in very severe psychological distress. And in fact, this video is inspired by someone who's suicidal as a result of these stories. And so please, journalists, bear that in mind. And if you are one of these suicidal people, then please learn to try learning to flip it the other way around. Because, so the situation is far more positive. And look at your own reality. Like in my case, none of my relatives have died of COVID. I'm not so much lucky as my relatives have all been careful. They've all been, that's my extended family, my sisters, brothers, their husbands, wives, and children, and grandchildren. Then they are all, they've all been vaccinated as quickly as possible. As soon as they've offered the vaccine, none of them have had COVID, had been in hospital with COVID. One had long COVID, there's another one had COVID, and the rest haven't had COVID at all. And so that's my situation, and many people in that situation, where they've got where none of the people that are, none of the people close to them have had COVID, have been in hospital with COVID. So when you get the focus on the troubles the hospitals are having, and they are going to have troubles, they're already having troubles, we're going to have more troubles for a few weeks in January, then do bear in mind that this is the media focusing on the bad story, it's the dramatic story, the scary story. That's what they do. And the rest of the United Kingdom isn't in hospital. I'm not saying the hospital case is very important, the hospitals are very important, the healthcare is a very difficult situation for healthcare service. I'm not saying these stories are wrong, but the headlines exaggerate and flip them, and then you don't get the stories about all the positive things that are happening. So your world is being filtered. There's also positive things happening. Lots of people who are not in hospital with COVID. Most people are not in hospital with COVID. Most people aren't dying of COVID. We are not headed for a situation with everyone dying of COVID. And this is going to end in, by the end of 2022, it's going to be hugely improved. And I can't even think of a big positive article. Can you think of a positive media article that's explained what I've just explained in this video about how by the end of 2022, and even, I mean, this is a social media q/a of the World Health Organization, and they said that they're hugely positive. Dr. Maria Van Kerkhove saying she's hugely positive about what's happening, going to happen by the end of 2022. Dr. Mike Ryan going into much more detail, going into detail as well. Dr. Maria Van Kerkhove going into the details of the science, and Dr. Mike Ryan also. And going to Dr. Maria Van Kerkhove is the specialist on COVID. And they give very good social media q/a, very positive and upbeat. I'll link to their video and my article about it in the video description as well. So if you're feeling a little bit down and discouraged, then that's quite a good video to look at. Or if you want a shorter version of it, then I've done a transcript with one-line summaries at the end of each paragraph, the kind of main points, the bullet points of what they were saying. So it's not me on some fantasy of my own. This is the reality. This is what the World Health Organization is saying. We've got a hugely positive future for 2022. So if only we could have had more positive stories explaining that in the press. And if only, and it's not the journalist's fault, I'm not quite sure how to change this, if only we could somehow make positive stories more click-worthy. If the more people clicked and shared a positive story about COVID, then the journalist would write those headlines with the positive headlines. And it's because people click and share the negative stories that they have to do these negative headlines in order to get anyone to read it at all. So do bear that in mind when you're reading the clickbait stories and make it out to be so negative. It's not true. Our medicine is absolutely amazing. It's absolutely extraordinary what we've been able to do. We've been able to fight COVID in a way that's been totally impossible 20 years ago, or even 10 years ago. If this had been 2012, we would not have been able to fight COVID in this way. We would have been helpless. Especially 2003, if you could somehow switch COVID with SARS, we were just lucky we got SARS before COVID, then we would have had all this would have happened, and we would not have been able to test for SARS, for COVID, for quite a long time. China would have kept it secret for months like it did with SARS. There would be a huge outbreak in China. China would not have stopped COVID in the year 2003. It would have been all over the world. The whole world would have had it, and we'd have had Omicron in 2003 to 4. And then it might have been over faster, but there'd been millions of deaths. So we are very lucky that COVID happened in 2020 instead of in the year 2000 or the year 2010, because it's just extraordinary. The year 2000 was when they first finished the complete genome of the human, the first sequencing of the human genome, sequence that we can do now in hours. Or a couple of days or something, we can complete the sequence of human genome. I'm not quite sure what the timing is now. And we would not have not been able to sequence COVID in the year 2000 in the way that we did in 2022, taken ages. And we wouldn't have had PCR tests, and we wouldn't have had LFT tests, we wouldn't have been able to test for antibodies. Imagine fighting COVID without the PCR test. So it's just just no way of testing if you got it, and no way of telling the difference between flu, a cold, and COVID, except by symptoms. That's where we'd have been in just a decade ago, 2 decades ago, certainly. So it's just extraordinary what the way the science is delivered. And it's basically because of the science that we've managed, that we've done, and we've achieved astonishing things in the way we fought COVID. It's been absolutely astonishing. Vaccines so fast, therapeutics so fast, such good use of therapeutics. And so please, hopefully that'll help you be a bit more positive. If any of you are feeling suicidal about COVID, then I hope this has helped you feel a bit less suicidal. And just if you've been thinking about this for a long time by yourself, then you may have developed very negative thoughts in your mind, and you mightn't believe what I've said in this video. You might think this is just me being fantasizing or something. Do check my sources, do listen to the World Health Organization, and give this a long thought in yourself. Just keep thinking and just try and realize there's a different perspective from the negative things you see in the clickbait titles, and try reading this science article, and you'll see some of the details in it. You can skip the section in the middle about how does it vary from previous variants. I'm going to do a separate video on that, maybe tomorrow. And so I'll stop and I'll upload this, and hopefully this helps some of you who got so scared about COVID and Omicron. It's going to be a rough few weeks. So the short summary is going to be a rough few weeks, for 2 to 3 weeks. If you get a big surge coming up in your country, then it's probably over in a month, most of it. It might take a month or two before the surge starts if you've got your first Omicron cases. If it's already going this steep vertical surge, it's probably going to be coming down again a month later. And you're going to have 2 to 3 weeks when the main risk won't be the ventilation and won't be so much oxygen unless possibly we're in one of the countries with low levels of vaccination. So it's possible, sadly, that the United States may have the same problem of shortages of lots of oxygen needed and of lots of people in ICU. We don't know that yet. So it might be similar to previous waves in the United States. In countries with high levels of vaccination, or countries that haven't managed to keep COVID out and have already had serious previous waves, it's likely to be less than the previous waves. So, anyway, and then after that, the situation is looking really, we may have another surge after that of some other variant later on in the year, but hopefully that'll be less severe even than Omicron, and then after that, then we've got such high levels of vaccination globally because of COVAX and because of the World Health Organization, that by the end of 2022, then it's going to reach the point where if we do get more surges, it's very unlikely that they're going to have high levels of death. They're going to have low levels of death and low levels of hospitalization. And then towards the end of 2022, unless we're extremely unlucky, it seems very likely that we're going to have the possible new vaccines that are able to even stop transmission, which will help even the unvaccinated and the vaccine hesitant and the anti-vax people, because it stops it getting to them. And so by the end of 2022, maybe before that, we might even have that as soon as the second quarter of 2022, and COVAX is quite likely to be distributing second and third generation vaccines, which will be really very much better even than Pfizer was. And that's quite a strong possibility. I would say that's a very high possibility because of the extremely high acceptance rate, approval rate of the phase 3 vaccines that we've been seeing so far. The few vaccines that haven't been approved are mainly approved because the companies, all except one exception, I think, one exception, the company withdrew it because they wanted to make a better vaccine, and then other vaccines they withdrew because, and then there's one vaccine that this was rather techie reason why it was withdrawn, and then most of the other vaccines, they were withdrawn because the companies saw that there's so many good vaccines in the trials already that they thought their resources are better spent in other directions, such as developing new therapeutics. So just about all vaccines that reach phase 3 get approved. And the one vaccine that reached phase 3 and wasn't approved was, I think, CureVac, was the one, because they decided that they didn't get as good results as they expected in phase 3. They could have gone on and tried to get it approved, but instead they said, well, we'll make a better vaccine and then try again, because their vaccine just wouldn't have succeeded against all the competition of the much better vaccines. So they decided, oh, well, we'll make a better vaccine. We've learned how to make a better vaccine as a result of our trials. So I expect these much better second and third generation vaccines to be approved. Anyway, I better upload this now because it's getting quite long, and hopefully